Good morning. I hope everybody is well. I love February. February is full of great celebrations. Of course, Valentine's Day, when we spread the love to all, and we have some fun stuff going in the office, so don't forget to check it out. But we also talk about all matters of the heart. This is Heart Disease Awareness Month. And as you know, I love to bring on our coffee chats specialists that deal with specialties that kind of overlap into our dermatological referrals. So I am so happy that this morning Dr. Parikh is my guest. He is the new neighbor in our building. He's a vascular surgeon. Good morning and welcome.
Good morning, thank you.
And I'd love for you to introduce yourself to all of our viewers and talk a little bit about your training and how we got you in the building, so to speak.
Absolutely. So I just want to start off by saying thank you to you, Dr. Pare, for having me and for thinking of Gauld Vein Vascular. We at Gauld Vein Vascular, we really have an emphasis on patient education, and that's kind of a passion project of mine. So I really love that you guys do this. It's a really great opportunity, and thanks for thinking of us.
I'm so glad you're here.
Yeah, so I am originally from the Northeast. I grew up in New Jersey, but did all of my education and training in Philadelphia. So I finished my vascular surgical training at the University of Pennsylvania, and about 3 years ago, my wife, 2 kids, and I relocated down here to Metro Atlanta.
Wonderful.
I was in private practice for a bit up in Marietta, and now I'm kind of off on my own with Gauld Vein Vascular.
Wonderful. Well, I'm so glad. I feel lucky that we have you. As I've mentioned, as a dermatologist, we certainly see patients and talk about leg veins. We talk about tiny leg veins and get questions about a little bit more extensive vasculature. And I know that is a passion and interest of yours. And I thought we would start with kind of discussing a little bit the pathophysiology. What should we be sending to you? How do things happen? How do you assess the patient?
Absolutely. So I think the first thing that we should talk about is the difference between spider veins and varicose veins. So spider veins, which are also called telangiectasias, they are very small, superficial, just underneath the skin veins that have kind of a web-like or a tree-like appearance. And they can be a number of different colors, red, blue, or purple being the most common. Now, varicose veins are kind of deeper in the skin. They have these kind of ropey, twisted appearance, and often can occur with spider veins. And so when we talk about treating varicose veins and spider veins, we really look at the distribution of where they are on the leg, and that helps us guide our treatment plan a little bit. So, one of the big underlying causes that we look for is something called superficial venous reflux. It kind of has a number of different names, but essentially, when we talk about the drainage of your leg, meaning the veins, which are responsible for bringing blood from your feet back up to your heart, we talk really about 2 different systems of blood vessels. There are deep veins that lie deep in your musculature and close to your bone. And every time you walk, exercise, and contract those muscles, namely your calf muscle, you're compressing those veins and shooting blood back up to your heart. That is responsible for the bulk of the venous blood return from your leg. But what you do have are also these superficial veins that are inside, just underneath the skin, on the inside of the thigh and calf and on the back of the calf. And they have these one-way valves that kind of work against gravity to bring blood back up to your heart. Now, over time, these valves, which are very thin kind of pieces of tissue, they can give out or fail. And when that happens, instead of blood just flowing back up to your heart, it starts to flow in both directions. And when that happens, basically the pressure in your superficial veins starts to increase. And that pressure gets referred out to the branches of those veins, which can often appear as varicose veins, the branches of those veins, and the branches of those veins all the way out to the level of the skin. And that's why when we see people who have spider veins, and we start to ask a little bit more questions and delve a little bit deeper, we can uncover that they actually often have symptoms related to superficial venous reflux as well. And those symptoms are things like leg heaviness, tiredness, leg discoloration or swelling, and one thing that we see very commonly are symptoms of restless legs.
It's so interesting, because during physical exam, of course, we do a full skin check and talk to patients about these little superficial vessels. Those are either commonly seen or they're brought up by the patient. But I do tell patients, think of it like a tree, that you really can't just address the superficial ones. We do in the practice do a little bit of sclerotherapy, but the question always is from the patient, And we do get very nice results from some of our practitioners, but it is important to understand when to refer and when to really look for success. And we do that a lot. And I know that as every field, vascular surgery has expanded in the matter as well. So let's talk a little bit about the treatment. What is currently available? Maybe even before the treatment, let's talk about the true workup.
Yeah.
And then go into the treatment itself.
Absolutely. So, when we diagnose somebody with spider veins and talk about the basically workup, the very first step is usually always a venous duplex ultrasound to essentially look for reflux in the superficial veins. And what our sonographers and technicians are doing when they are doing that ultrasound is actually measuring the time in seconds that blood is flowing backwards instead of forwards. And that gives us an indication of where exactly the reflux is and how severe it is.
And that's of course completely non-invasive. Patients
completely
always worry about that.
Yeah. Absolutely. And then from there, we kind of develop a treatment plan. And that generally involves us treating the superficial veins first. And now when we identify reflux, the goal of treatment is to actually close the veins that are refluxing or not working properly. And your body naturally reroutes the blood flow to the veins that are working properly and to the deep system, which, as we said, does the bulk of the work.
Right.
And we kind of, I like to work from the inside out. So we start with the deepest, we call it the deepest, but it's the superficial vein first. And then we treat the varicose veins that might be associated with it all the way out to the level of the skin. And what that does is not only are we, treating the symptoms that might be associated with the reflux and providing patients with a significantly improved quality of life, but we also give patients a durable cosmetic result when they actually end up having the sclerotherapy.
Because I hear sometimes patients will say, it just didn't work. But clearly this was not addressed on an appropriate level. Just a few superficial ones may have been addressed, but really not working from the deeper level up where you really are addressing the root of the issue. And you talked about quality of life. I mean, I think that that's so important to emphasize because these are very treatable changes and really make patients feel much better. And it's not just women, right? I mean,
it is not just women. There's a statistic out there that patients with symptoms of superficial reflux live for 35 years with the symptoms before they actually seek treatment.
Right.
So that just, most people chalk it up to, well, I'm just getting older, or aren't I supposed to feel tired? But that's not really the case. And really this is not a life or death issue, but it's a quality of life issue. And that's just as important.
In the clinic, we are so focused on longevity, whatever that really means. I think it means for us a lot with the skin, but it means very holistically with the body. And we do change, we do progress, but we can do it in so many different ways. And I think this is one of those very important examples that you really can, in a fairly simple way, change the way you feel. So I know injections, but is there anything else that's done for the deeper vasculature or even for the more superficial ones?
Yeah, and so that's a great question, and kind of, I think that there's a misnomer out there that when we're talking about treating superficial venous reflux and the word surgery gets thrown out there, that there's a lot of downtime associated with it. Most people are unaware that it's a very treatable condition. And most people are back at work or on their feet the same day or the day after. So there's very little downtime associated with these procedures. But essentially what we can do for the superficial veins when they're refluxing, like we said, the goal of the treatment is to close those veins. So we have a couple of different ways we can do that. One is through heat-induced methods of closure, and these are all minimally invasive techniques that we can do right in our office.
So are these lasers, or what do you mean by that?
No, so there are a couple different options when we talk about heat. There is laser therapy, and then there's also radiofrequency ablation. And these are essentially just two different modalities we can use.
Radiofrequency in dermatology, so that's great to know.
Yeah, and so really they're just two different methods by which we can generate heat to close the veins from the inside out. And then we can also kind of adjunct that with something called ultrasound-guided foam sclerotherapy, where we can inject a foam sclerosant using ultrasound guidance directly into the veins and the varicosities to directly close them off.
What's the comfort level when you do these procedures? Is it pretty comfortable?
It's pretty comfortable. It involves a couple of needle sticks where we deliver some numbing medication. And then we like to use an adjunctive kind of analgesic, so to speak, called Pronox, which is laughing gas or nitric oxide.
Very familiar with that. Lots of procedures in derm that we do that also require a little bit of anesthetic like that. Yeah,
Yeah, and so
analgesic like
patients
that,
really
yes.
enjoy that aspect of it as well, and really is generally very well tolerated. And like I said, the goal of treatment when we're talking about veins is not to go home and put your feet up. We want people active and walking and promoting all that good blood flow through their deep
So
veins.
that brings another point, so post care, I mean,
Yes.
are patients wearing support hose? Are they wrapped? What's the typical
Yeah,
recommendation?
So typically they are wrapped with an ACE bandage for about 24 to 48 hours, depending on the type of procedure that they had done. And then they're wearing thigh-high support hose for an additional 2 weeks.
2 weeks.
Yeah.
I know a lot of women complain, but this may be a great time of the year to do these treatments,
Absolutely.
when it's kind of cold outside.
Yes.
So worth remembering that, schedule your
Yeah.
appointments according to the weather. But that's great. But overall, it seems like it's a pretty easy recovery. You go
Yes.
back to your everyday
Mhm.
activities quite quickly.
Quite quickly.
And of course, one of the questions that I get asked is this covered by insurance? What is
Yeah.
what is the typical process? Do you put some of these through the insurance approval, or these are all out-of-pocket treatments?
Yeah, so I think that, like you said, there's that misnomer when we talk about spider veins that things are not covered by insurance, and while treatment directly of the spider veins often is not covered, when we start delving deeper and uncover that superficial reflux, all of that is generally covered by insurance. So the majority of things we do are covered by insurance. Yes.
Well, wonderful. I think this is such incredible wealth of information. I think that such a common discussion in our clinic. I love to know that we can refer patients for a true workup for a condition that really could be lifestyle changing, that can be performed on younger and older patients. I think that's great to know. I also want you to put a plug for your wife who is in practice with you, which is another specialty. Tell us a little bit, and I'm going to certainly host her, have her own seat on our coffee chat, but she's a podiatrist.
Yeah, she's a podiatrist. Her name is Dr. Ushma Sheth, and the name of her practice is Gould Foot Ankle. So she sees patients in our building here in Buckhead,
Right.
But has another location in Marietta as well.
Wonderful.
Yeah.
How can patients find you? Do you have a website?
Yeah, so you can find us at gauldveinandvascular.com. That's GAULD, veinandvascular.com. And our office is just upstairs from you guys here in Buckhead, and we've got another location, like I mentioned, in Marietta.
I know. Well, we're so excited to have you this morning.
Yeah.
Thank you so much. Love having great neighbors. Have a wonderful Tuesday. Thank you again for joining me.
Thanks for having me.